Hello everyone, and welcome. Welcome to this audio podcast. Synopsis. This audio podcast synopsis as part of the Bostics and Rubble. This audio podcast is part of the Crispa and Beta. This audio podcast is part of the Ground Rounds, and this audio podcast is part of a Storm the Bostics production. In this audio podcast, a synopsis, and as part of works, as part of this series, looking at some collaborative works, looking at from infection prevention to looking at education and employment for young people in who have undergone solid organ transplantation or solid organ transplantation recipients, and looking at a question of what is point of care practice. So knowing that there are school and or employment opportunities for young people, for young people and young adults after undergoing solid organ transplantation or SOT is of importance. On the one hand, research has evidenced and demonstrated that undergoing solid organ transplantation improves sort of functioning compared to those young people in chronic illnesses that are still on solid organ transplanting waiting lists, and at the same time, evidence indicates and informs in across different chronic illnesses, and different chronic illnesses or different chronic illness cohorts, that are in, around, and pertaining to specialties that require young people or populations that would require solid organ transplantation. Evidence also implies that it is better not to delay solid organ transplantation in amongst a minority or young people's population. On another side, evidence informs informs sorry evidence 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 has not informed in around sort of the statistical differences, differences in young people education and young people in education and employment status between those in solid organ transplanted recipients, and sort of other reference cohorts. Nevertheless, investigation and evidence have informed that if young solid organ transplantation recipients are encouraged and attention is given by healthcare professionals, it is possible for them not to only transition between healthcare services but also to aspire. Patients at the same time want more understanding of healthcare in a range of areas and across a range of areas, and different and require and often require different healthcare professionals to be part of healthcare services, where they can get more integrated care. E-health or e-clinics, for example, can make sort of healthcare discussions more effective or more efficient. Evidence also indicates that more young people are at an increased risk for infections young people in amongst solid organ transplanted populations, for example, are at increased risk of infections compared to those who are non-immunocompromised. However, there is no consistent literature or evidence that indicates that that young people, younger and or young adults are more at risk of infections, when when in and when there is challenges around sort of aspects of pathophysiology. Improved access to point of care testing, POCT, and diagnostics and infection prevention for healthcare services through healthcare services differ also across healthcare practices. Healthcare services differ owing to the lack of integrated patient services or healthcare services, and in and around sort of the differences between healthcare services without a multidisciplinary team or MDT involvement. Thus, a disconnect still exists surrounding and in between healthcare sectors and services for young people and young adults. In this audio podcast series, there is a look at a question of what is point of care practice and the importance of looking at sort of the importance of education, aspects of education and employment for those who go through for young people, young healthcare service users that go through solid organ transplantation or in around aspects of solid organ transplantation, but also in around chronic illness populations. That draws this audio podcast to a close. This audio podcast as part of the series, the Bostics and Rubble, the Bostics and Rubble, the Crispa and Beta. This audio podcast as part of the Grand Rounds, and this audio podcast Synopsis as part of a Storm Lobostics production. Some terminologies just to inform that can be utilized to identify literature in amongst database in amongst online search engines, for example, include young people, pediatrics, nephrology, point of care practice, and or chronic illnesses. Thank you for tuning in.